opportunity to be a part of this lecture, and I have two pressure right now, explaining the important part of the NABH and the second to conclude it faster. So without wasting much time, we have actually divided the lectures into three parts. First, introduction was given by Dr. Rajesh, and Dr. Chandmani Yadav gave us the insight how the documentation is important. But NABH says that whatever you document, you should do it, and whatever you do should be documented. Because if you do and don't document, that means it is not done. And if you document it and if you don't do it, then that is something different. We all understand it is not correct. So first of all, this is something practical aspect. I will give you what we went through when NABH assessor came to our hospital. So first of all, we should be clear in our thing that what kind of services are we giving to the patient and what kind of scope of services is not available in our scope. First of all, if the emergency is not available, as it is not available in RRM Patna, it should be mentioned clearly that emergency services are not available, and whatever the scope is there, whatever you are providing, like OPD facility, IPD facility, and in that noise the surgery, whatever you are giving to the patient, you can write the scope of the service and in the front main building gate. But in case of we are not only the one who runs hospital as an admin people, but so if any emergency situation comes, because NABH assessor asked us, okay, yes, okay, you don't have emergency service, but what if any patient here faints, or any patient here goes hypoglycemic, or any patient gets into hypertension crisis? What are you going to do? At that time, we are not supposed to refer the patient because that patient is in the critical situation and we are not supposed to attend the patient as well. So being a Unani physician, it is a challenging task that at that time, what kind of service are you going to give? If the patient, are you able to give CPR to the patient? Are you able to manage a patient who is having MI, or you are going to leave them and say, no, हमारे पास ये facility available नहीं है, please go to the, this is not correct. So being a healthcare provider, this is important. This will be maybe asked by NABH assessor. And another emergency is emergency in the hospital. If there is a fire in the hospital, if there is any slip, fall, electricity shutdown, if anybody is in the lift, how will you understand and how will you take care of all these things? So I have actually divided this into three. How you will do the care of the patient, and how you will do the care of the employee, and how you will do the care and safety of the hospital premises. The first thing, OPD facility in which signage should be present. The patient is coming and he doesn't know where he should proceed. So signage should be there. This is the dispensary area. This is the registration facility. What happened? And if the token system is available, it is fine. If it is not available, it is not mandatory. We do have that. There should be a separate queue for male and female patient. Registration counter people should be well trained that how they are going to attend the patients in a very nice manner. And the OPD, very important part is recording of the vitals and prescription. Here is the one sample prescription which you can see. I think if it is not visible, please try to see that. You have to write the complaints also. You have to write the medicine, and medicine, if you write Zikra-RO, BD is not understood by the patient. So you should write in such a way that a prescription should be understood by the patient. So they ask this, the BD, what patient will understand. So जो भी है उनका language here, Bihar, Hindi is the first language for the patient. So write the prescription in Hindi as far as possible. And you should also mention per case section what are the dietary restrictions, what are the dietary recommendations, and what is the diagnosis, and also the time span. Like I have done my sign, I have given the date, and I have also mentioned the time. The patient came to 2:48, I think it's not visible, somewhere 2:48, the registration time is there, and I have seen the patient at 3 p.m. That means waiting time was around 15 to 20 minutes. So this is how the NABH assessor will understand what was the waiting time of the patient. Pharmacy, this is The pharmacy is a picture of our pharmacy in which we have kept Lassa medicine and look-alike and same alike and sounds alike and high-risk medicine we have kept in a separate way. This is how, or we can also keep it in a better way. This was our budget, so we have kept like that. And we have to train the staff. People here, there will be a dispensary in charge, a pharmacy in charge, but NABH assessor is not going to ask them at all. They will go to dispensary and they will go the one who is distributing the medicine. How are you distributing the medicine? How are you saying the patient कि कैसे लेना है? Is it written? Is it mentioned? Is it labeled? All these things it will be asked by. So this training is very important. फार्मेसी इंचार्ज को पता हो, इससे ज्यादा भी इम्पोर्टेंट है कि वहाँ के जो स्टाफ मेंबर है, ग्रुप सी ग्रुप डी के जो भी ये है, उनको ज्यादा पता होना very important. So all the labeling, and you should have the list of food drug interaction. We did not have, so we got they asked us to do this. So food drug interaction list we made later. IPD facility में only admit the patient who falls in the scope of the service of the hospital. Case sheet, I have the case sheet. We had the case sheet before, and it was lacking many information. And we have revised it a lot number of times, and finally they accepted a final revised case sheet. I have brought here, and I will give it to any neurologist or clinical people. If he is there, they can please check this case sheet. Whatever is there in this, like whatever should be there, like TPR chart should be there, medication chart, results assessment, nutritional assessment, discharge summary. Discharge summary should have a carbon copy. Like one, you should have. If NABH assessor will come, they will ask about the discharge summary. So I will give this to somebody. Please check it out later. And oxygen supply, oxygen cylinder should be there available. Physicians and nursing staff should be there available. 24/7, any RMO should be there. And the curtain should be there to maintain the privacy of the patient. And vulnerable beds, like if you have 10 beds in a ward, then minimum one vulnerable bed should be there that have the rails and the beds, so that they ask. And you have the referral form. These are the documentation. Each and everything is important. If you miss any, you will get it very free. So better to do it beforehand itself. Ambulance service, if you have, well and good. If you don't have, sign an MOU as said earlier, and designate a space in your hospital premises. This is the, and please display that this is the area for ambulance. Regiminal therapy is the most high risk area for Unani medicine people for our hospital. So they spend at least like adequate amount of time seeing that you have all the facility, because NABH is a care of patient, and in that if you are harming the patient, you don't have sterilization process, you are not doing it properly, then this is the major concern for them. So whoever is involved in regiminal therapy unit, please take this. You have the main role for this to clear this out. So adequate amount of light should be there in the OPD. There should be a slippers. Like you have to make the regiminal therapy in such a way that someone is entering OT. The slipper should be outside, and there should be an elbow tap. After washing the hand, you are not allowed to touch the same things. So elbow tap should be there, and you have to label all the chemicals. Sterilization of all the equipment. How do you sterilize? Again, this will not be asked to regiminal therapy in charge. This will be asked to the one who is working there. Say any nurse, any paramedical staff, whoever is working, they will be asked, how do you sterilize the things? So there should be a separate housekeeping checklist should be there. How are you like they will be asking if after doing bed cupping, how are you disposing of the blades? How are you disposing of cotton? How are you doing? Are you practicing the BMW inside this regimental therapy session? So all these things, and if there is any problem, like if the blisters is coming out of any, even at the dry cupping or fire cupping, are you maintaining any area, like any like adverse reaction? Are you maintaining? Do you have any register to maintain it? So they will be asking the register also. Informed consent is very important. Except massage, even for dry cupping, for our SOP manual, it was there that you have to get the informed consent from the patient, and all of these things are there, which I think everybody knows, being a physician, that we have to check the vitals, we have to see CGBT, HbA1c, HIV, and we have to complete the process of these things, and will not take the details. Research is going on because I think postgraduates are also here. So if you're doing the research, the main concern of NABH assessor is again the care of patient. So they will ask, if are you getting informed consent, how are you enrolling, what सुविधा आप दे रहे हो research patient को, why should they come to your research? So all these things will be asked. And now that was the care of patient. Now even the employees are important. The physicians, the people who are working inside the hospital. So these are the outlines that how the care we are giving to even to the employees. First, uniform is very important. If somebody is working in lab, then this kind of uniform, which is in the right side, long lab coat, shoes, gloves, so that they are not prone to any infection, bloodborne infection. If somebody is working in regional therapy, all gloves, care, and everything should be provided to them. Housekeeping staff should have certain whatever uniform you decide, it's up to you, but they should have a uniform. Please make sure that they don't wear any plastic gloves or any normal surgical gloves, because they take out the kachras from BMW, so they are also prone to infection. They should not be prone to hepatitis B, and also the thick gloves they should be given, caps they should be given. So these things you should take care of. Hand hygiene, they are not going to ask you at all. They are going to ask the housekeeping staff. So they should know how they have to wash hand. There are 6 steps. There are various steps actually. One of the very easy steps is Sumang, which you can train them. They will ask them, how do you wash hand? Do you know the ways of washing the hands? Cleaning, how do you clean the floor of the hospital? What do you use? Do you use phenol? What do you use? You use sodium hypochlorite. So standard is to use hypochlorite 0.5%. And they asked us when they came to our hospital. They asked our housekeeping staff, how do you make sodium hypochlorite? So they should know how 0.5% how it is made. And when do you make? Do you make once in a week, once in a month, once in a year? But because sodium hypochlorite is only viable only till 24 hours. So you should know this, and you should tell them properly that we make it every 24 hours. Freshly prepared sodium hypochlorite is made and used, and it is stored, how it is stored, everything there will be. If a blood is spilled in the hospital, so it becomes infection prone. How are you going to wipe off, like you wipe off some other things? How are you going to do that? Mercury is spilled. If you have mercury apparatus, like BP apparatus, it is better to have non-mercury apparatus. But if you have mercury apparatus, then you should see if mercury spillage is there, then how you are going to clean it. Biomedical waste. First of all the housekeeping staff should be trained कि biomedical waste जहाँ पे generate हो रहा है वहीं पे उसका segregation करना है. One should not generate and other should not segregate. The same person should segregate, and then it should be, all the training should be given, especially in biomedical, separate register should be maintained, and if the dustbin is full till 3/4, then it should be disposed of. So these are the small things. You can go through the SOPs and you will come to know. These are the color of the color-coded dustbin. Very important. Along with the color-coded dustbin, you should also display कि कौन सा कचरा कौन से dustbin में डालना है. Everywhere you have the dustbin, you should have a display on the wall. They ask that. And this is our RRM, a separate spot, a center for collecting the BMW. At the end of the segregate them in this, and the personal responsible authority is responsible to take all the things they take from this. So this, where it should be located, it should be located little bit far from hospital, not near the hospital, which is approachable to the patient. It should be little bit far. And this, what you can see in the left side is, you have to maintain this record कि हर दिन में कितना कचरा जनरेट हो रहा है, कितना वेट है उसका, पूरे महीने में कितना कचरा आपने जनरेट किया, because you have certain license, certain authority, इतना ही कचरा आपको जनरेट करना है, उससे ज्यादा आप नहीं जा सकते. So this you should have an NABH assessor, maybe they will ask you. safety of the hospital staff. This each and every point is very important. Uniform, as I already said, annual health checkup should be done. Like vitals, all the employees' annual health checkup file you have to maintain. All the biological and pathological parameters, whatever is available in your institute, and if it is not available, you have to go get it from outside. And documentation should be there. Vaccination, at least all the people who is working in hospital should be vaccinated for hepatitis B and tetanus vaccine. If someone is vaccinated for hepatitis B before within 20 years, just get the declaration form, self-declaration form. Okay, yes, I have been vaccinated. If they have not vaccinated, then you have to vaccinate because they ask this. Emergency code training should be given to everybody, like fire emergency, any death emergency, any kind of natural disaster emergency. And the information on the lift, inside the lift, all the information should be available. If someone is inside the lift and suddenly there is electric shutdown, so what are they supposed to do? If they don't have phone in their hand, we should assume this kind of situation. Okay, it's time and what they could have done. So a phone number should be there, or an alarm should be there that they can press, and even in the electric shutdown, people may come to know. And if someone is going through needle stick injury, what are the things you are going to provide them? That was the safety for hospital personal people who are working with us, like all the housekeeping staff, the people working in the lab, all the physicians, nurse, paramedical. Now this is safety of hospital premises itself. If there is a fire safety, or if there is any incident, or if there is any emergency. So first, this emergency, like अगर कोई patient is coming, then how, if they are not able to walk, you have to have these grab bars, and you have to have these vulnerable beds. You have to have safety belts. You have to have warning signs and fire safety devices. Fire safety, it is better to do a training program as well as mock drill and maintain the register. Every whatever training program, you can get the PPT that in quarterly you have to do the training program, and after the training program, please maintain the register, and please everyone should know, like not only the physician, आग लगने पे anybody, मतलब कोई भी इस चीज को alert कर सकता है. So where is the safety alarm? Who should go and press it? What should you do? And please make sure that the hospital employee should be the last to leave the hospital. First, please take care that patient should leave the hospital, and then whoever is working outside should leave the hospital. And then, because you are responsible person in the staff, so it is your duty that you are going to leave the hospital in the last when there is any fire emergency. There are so many other things as well. This is the fire equipment devices which is present in NABH of Patna. And incidents, there are many kind of incidents. Please maintain a register about incidents of reporting and corrective action and preventive action. Like if anybody has incident of fall, then how did he fall? What could have been done that would have prevented the fall? So these things you have to make the corrective so that next time the same incident should not repeat. If there is an injury, like for example there is a needle stick injury, then that person is prone to hepatitis, because we don't know, the person is prone to tetanus, we don't know. So whom should he report? के पास जाए बोलने के लिए? Then there should be a safety officer to whom the person can go, and then the rest of the thing, whatever he has to do, he has to get the vaccine, whatever he has to do, then he will get this proper guidance. Okay, after the injury, what can be done, and please maintain CAPA report for that also. The same kind of injury, like that. For example, you could have given a thick rubber gloves to that person that could have prevented that injury. And if there is a death in the hospital, see, death in the hospital is not very uncommon. Anybody can go to emergency and anybody can die. You should not be scared that in the death of the hospital, but you should be scared that were we not present at that time? Are we not fulfilling our duties at that time? What was the reason? If the physicians are not there, if the nurse is not there, if you are not giving the full whatever the rest of our abilities is not there, if you are not doing that, then that become problem to us. Otherwise, it is like in hospitals, it is okay. But as I said in the beginning, we should not admit the vulnerable patient. Only the patient who is under the scope of the service should be admitted in our hospital. If there is any sexual harassment in the hospital, I hope there is a POSH committee here. Anybody who will be presiding officer of the POSH. If it is not, please make sure that please do the initiative to make a prevention of sexual harassment committee. If it is not there, and then the hospital employee is liable to pay some amount of fine if it is not there, because a hospital or office who is working and there are more than 20 number of people, then there should be a POSH committee to prevent the sexual harassment. So if that kind of incident is there, you should report that. You have to make a kappa for that also. ADR reporting should be there. Yesterday, I attended a program in Bangalore. In that, they told me personally, कि पटना से कोई भी एरिया रिपोर्टिंग नहीं जा रही है उनके पास, बहुत कम एक्टिविटी पिछले 6 महीनों में हो रही है. So this hospital is pharmacovigilance center. So they are expecting more area reports from this hospital. And please, we also have so many patients, but we are not the center. So we will make some kind of this, that if we get any area, then we will send to you. Then how you are going to communicate further to the NIO Bangalore. So this should be done. All the training should be done. Like this is the training, this is very important training. Very frequently the training should be done. All the 10 chapters which was verbally told by Dr. Rajesh should be implemented. And before implementation, all the 10 chapter training should be given to all the hospital staff. CPR training should be done. Anybody who is working in the hospital should know how to do CPR. Hand hygiene training should be done. Okay. Fire safety training should be done. The biomedical waste training should be given. POSH awareness should be made among the people. Emergency code training should be done. Lab safety training and HIC training should be given. Thank you so much. As it was so much in this slide that I didn't have the time to tell, and I didn't have time to make it. So 2-3 slides I have made together. I want to share this credit with 2 people to whom I have got the help for this PPT, and thanks to all the NABH team for this opportunity. Thank you.
Thank you, ma'am. I request Dr. Shahina Firdaus ma'am to present the memento to Dr. Zikra ma'am. Now it's time for the felicitation session. So I request Dr. Mumtaz Ahmed sir, Chief Guest, Dr. Shahnawaz Akhtar sir, Co-Hospital Superintendent, and Dr. Mohammad Raghib sir, Associate Professor, HOD, Jarahal. To felicitate Dr. Mohammad Razi Ahmed sir, Associate Professor of Knowledge Art, and also Program Secretary, Dr.